back at it. We back at it with the twins. With the bodega twins. You hear them. You hear them. We're picking up one on some. Ain't got no more bowls. And we're bringing the twins to get their shots. Yeah. Knocking these animals out one by one. One by one. Motherfuckers. Gotta take care of your animals, man. One at a time. I do it all at the same time of the year, so you'll be seeing me do this shit one more time for my other two. And these kittens too, man. They need, this is their second shot. They're about to get their second shot now, and then in about a month? In about a month, they'll get their third and final shots. And they won't see the doctor, hopefully, till next year. And then, but when I bring them for their third shots, I gotta bring my other cat and my other dog with them for their yearly. So I'm knocking everybody out around the same time. How you doing?
Sage and Steel.
Yeah, and
back there.
Steph is back there, right?
Yeah.
They just coming in for their second shots.
Yeah, I think so.
Yeah.
Hi, babies.
Yeah, they still fit in there, so. And they love being on top of each other anyway.
Yeah, I remember that. They were very close with each other. They had to be by each other. Yes. And get you guys over into the cat room.
Yeah.
This
Oh.
one's right over here. Alright. Come on in. And then I'm gonna let the tech for these ones know you're here, and then the surgery tech.
Yep.
Let them know you're here.
Yep, thank you.
Yeah.
I can let them out, right? Let them
Yeah.
run around a little
Yeah,
bit.
you're fine.
Stretch their legs. What's up, guys? We back at it. Some brothers and sisters. Brothers and sisters, the bodega twins. That's them tabbies. Where you going? Where you wanna go? Got it? All right, you got it. You got it. You too? You're sweating from your paws, or did you pee? Where y'all going? Where y'all going? That's them tabbies. That's the boy. And there's the girl. Where you at, girlfriend? You looking? Oh, you stretching, huh? You remember this place? The boy is getting mad big. He's bigger than her. Meow. What are you doing? You got sweaty paws? Yeah, so I gotta knock out their second shots. Pick up my pup. He just got his balls knocked off. You know what I mean? So he's about 4 months. We don't do that balls free shit. Period stuff for the girls. We knock all that shit out. So we don't gotta worry about it. Plus, having these boy and girl kids that like, you know, so close, they'll fuck around and start mating with each other, like if they not siblings and shit. And we don't want that. I see you. I see you, mama. I see you, mama. What are you looking at? Yeah, you gotta get your shots. Yeah, you gotta get your shots. Why are you biting that? Yeah. Yeah. She just evil Knieveled up here. Girlfriend, what are you doing? They're about like, what is it? They're about 3 months, right? 3 months? Yeah, they're 3 months. Because my pup is 4 months. Yeah. So they're about 3 months old, getting their second shots. They're indoor cats, so. What happened, sexy? Huh? You was eating, I know, I messed up your food time. Where you going? Man, so their paws are sweaty and wet, so they like shaking their paws and shit. I'm getting all shy. Look at them. Cleaning his face. He's like, yo, I was just in that bag for about 5-10 minutes. Not even. He was probably took me like a little less than 10 minutes to get here. But yeah. Oh, fuck. Oh. There goes one of them.
You're so cute. You're trying to escape, huh?
Yep.
How are the little ones doing?
They're all right. They're all right.
They're so cute.
Thank you.
Hi, sweetheart.
That's the boy, and the girl is the darker one.
Yeah. How have they been lately? Any concerns?
Yeah, I don't know, on her right ear.
Uh-huh.
I don't know, because Steph, and then, you know, when they were younger fighting, I don't know if somebody maybe just nicked her.
Okay.
And then my bigger dogs, when they were.
Yeah, I see it.
So I wiped it some time ago, not recently. I did it like 3-4 days ago, where I used like a cat cleaner wipe.
Yeah.
And I wiped it. It did bleed because it was scabbed up.
Uh-huh.
So I I just used that wet nap for
Okay.
the animals to clean it up, but it's kind of like a bump. So I don't know if it's still healing
Okay.
or is that like.
Or if anything, we could also just shave up the area for you and then clean it real nice, just to make sure it's getting a good. Hi, sweetheart. Hi. And then maybe apply like a little ointment on it as well, just to help within the healing wise of it all. You said this is steel?
No, that's Sage. That's the girl.
Sage, did your brother beat you up, huh?
Oh, it could have been Steph. Steph eats them.
Oh, really?
Yeah, the pup. I don't know. My pup that
Yeah.
he's somewhere in the back, wherever. He eats them. So that happened. We noticed that like maybe like a week or two ago. My thing is, it should have been healed up. Although it's not scabby no more. It's I feel like it's not healing. Like it's not going away. It's been there. You know what I mean? Like if it was like a cut, it would have been healed up by now. No.
Yeah, I see what you mean. Does she have any other areas that you've noticed just
Nope.
like that now? Okay.
Which is which kind of confirms the fact that that's probably in somebody's tooth, whether it was the big dogs or Steph or even him when they were, you know, when they fight with each other.
They're so adorable. They like to roughhouse.
Yeah, for the most part, yeah. He's just like that half a pound bigger than her.
It's okay. I'm just getting your temp. You're okay. It's okay. I know. Look. Are they okay to have treats?
Of course.
Okay.
Of course.
Let's get you some Cheerios.
Now you're gonna have their attention.
Other than the little scab that they have, any other concerns? Eating and drinking okay? Any
Yeah, no. They're doing everything fine.
Using that litter box all normal. Schools look normal.
Yep.
Do you want a little
Stinky.
treat? Yeah.
Stinky and smelly, yep.
Look.
They were tearing it up before. Oh, now it's on your nose.
You got it on your nose. Look, it's on your nose. Look. No? We gotta say something for your sister right now. And then not on any medications or supplements? Oh,
No.
you smell it, don't you?
She knows it's somewhere.
Are you trying to play, huh? Look, do you want some too? So for today, I have the Healthy Pet follow-up. It looks like you guys were here 3 weeks ago, and we started you guys on the FVRCP vaccine. So that one just gets boosted until we're the 16 weeks of age. So now that we're 12 weeks of age, we usually recommend a SNAP test to be done, test for feline leukemia, FIV, and heartworm. If you'd like to proceed along with that, we always recommend it for all of our kittens or our cats.
No, I'm not gonna do that.
Okay.
But which is the ones? So what are they? They definitely here for what though? Like one or two shots?
They're here for at least one. This is another one I usually recommend. It's feline leukemia.
Yeah, I don't do that.
No worries. That one's optional as well. Only recommends that for kittens.
Is this for one?
Yeah, that's for one, but of course it'll bring down once I decline the SNAP.
No,
test.
it's all good. Okay. Yeah. So I just didn't know if this was both of them combined for all. But the follow-up vaccine, right? We got to do that, right?
Yeah, our exam healthy follow-up, it decreased in price just since we don't have any other concerns.
No. I mean, otherwise that Husky. So I don't know what should I do? I mean, should I wait it out because I'm gonna come here in 3 more weeks, right? I gotta go like a month.
Yeah. I'll have Dr. Connolly take a look at it. Worst case scenarios, we'll probably just clean it up. Shave it, clean it up for you, and then apply the ointments just so we're able to really get the topical on there just to allow the healing wise to take it into effect. If that doesn't work in the next week, because you guys have one more visit after today.
Yes.
And then if that doesn't work, we could probably get you guys started on some like oral antibiotics just to help.
Which we'll definitely know the next time I come because but next time I come, if that's still there, it'd be there for over a month.
Yeah, correct. Yeah, but I'll have her take a look at it just in case she might recommend just a different course of that. Okay.
So yeah, just hit them with they're technically their checkup. Well, because I'm here for their next shot, which is only one.
Yeah. So if you don't want to proceed with the feline leukemia, then we'll just take off all of this.
Yeah.
And then in 3 to 4 weeks, then you guys will just do the FVRCP and then the rabies will just be the next step.
So and when I come back in about a month, they need 2 shots for that one.
Yeah.
One is rabies, which is a 3-year or the 1-year one?
1 year.
Okay.
Yeah, for our feline ones, the one is every annually for the rabies.
Okay.
And then the FVRCP will be good for a year.
Okay.
And then after that year is up, once you guys come back after that, then it'll be good for 3 years. The FVRCP one.
Oh, okay.
It's a distemper for cats.
Yep.
Alrighty. Other than that, can I just get a little signature at the bottom? And then I just need your weight, Sage. Hi, sweetheart. Do you want some diet, what is that consisting of right now?
I do give them like the IMS kitten,
Okay.
right?
Perfect.
IMS?
Yes.
Yeah, I'm gonna say IMS kitten. And then once a day we give them a little of the kitten wet food. Not the way I would give it to my older cat, but we give them, like we sprinkle it into all their dry food so they could taste that wet food.
Like a little topper on top
Yeah,
of it for them?
100%, yeah. But we only do that like once a day, but I leave the dry food out as, you know, because they graze.
Yeah.
And if Steph don't eat it, you know what I mean? So we constantly filling it because Steph runs up in there and then he eats it when we don't know.
I saw, so cute, so adorable.
He's nuts. He's super hype.
Yeah, he's at the right perfect puppy stages.
Biting. I don't know what he was doing with you guys. Or he was probably sleeping, right?
Yeah, we were doing his blood work and all his just like, of course it's pre-surgical work. He did pretty good for that.
Yeah.
And then afterwards, they just wanted to sleep off after the surgery.
The doc called me. It was so fast when he gave me a ring at home. I was like, I got scared as a mom. Like, why is he calling me?
Yeah.
Like, why is the vet? It's a veterinary, you know, East Valley. I'm like, hold on, like I just left like an hour ago, whatever. Like, why? This is too like.
Too soon.
I got dumb scared. Like, tell me something happened with this dude. You know what I mean? Like,
yeah, they're pretty quick. Sometimes we do it thoroughly efficiently, but because we have certain surgeries that we like go in order, just based off of just to make sure everything goes smoothly.
Yeah.
They probably did Steph one of the first ones, so that's probably why.
Because I was here like at 7 in the morning, but he sounded like he wanted me, and then he realized, like at the same breath, with the same breath, he was like, "Oh, but you got to come at 2 o'clock with your kids." So he was basically telling me like I could come get Steph, like. Right at that time, like it was like 9 o'clock. I was here at 7. By like 9 o'clock, whenever he called me, 9:30, whatever it was. But he was like, "Oh, I see you gotta come at." In the same breath, he was like, "But I see you gotta come at 2 o'clock."
He caught himself.
Yeah. So.
Okay. All right. Let me go ahead and grab Dr. Connolly.
Yeah.
This is our other doctor.
Yeah. The woman, the tall woman.
Yeah.
Yeah.
She
That's
does
fine.
appointments for the day, and then we'll be right back.
Yeah.
Trying to escape, huh?
What are you doing? What you guys are doing, huh? What are you doing? Look, the treat is over here. Look. 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 The treat is up here. Look. Look. The treat is right there. Look. It's right there. There you go. Come on. What happened, Steel? Yeah. What are you doing? Yeah, she got a little boo-boo on her ear. Come here. Come here. You see it? She got a little boo-boo. See? Y'all saw that? Got a little boo-boo on her ear. I don't know if somebody snagged her up. It was probably Steph, most likely. It could have been the bigger dogs too. Because that had to happen like a week or two ago already. And then I wiped it like last week. I wiped it, and because it was like crusty. I think my daughter told me that it was crusty, so I grabbed her up, wiped it down in a napkin like she was bleeding from it. And then I put like some ointment on it that's for dogs and cats that I have at home. And ever since then, it's never scabbed, but it's still like a little bump on her ear. them nice shots. Keep it moving. I want to get my boy. I want to see what my boy Steph is. Oh, there you go. How you doing?
We got a little one.
Yeah. How you doing?
Hi, you too.
How
are you doing?
I'm okay. How you doing?
Good.
Little skateboarding.
Alright.
You want to go first? Come here.
You guys are growing.
So that's Sage, and that's her little. I don't know if that's somebody snagged her.
It's okay. You're okay. Yeah, I mean, it's basically, it feels like scar tissue right now.
Okay. It's okay. It's
Sometimes
okay.
they'll get almost excessive scar tissue at a puncture site, so it's probably a bite or a scratch. I would keep an eye on it for now. There's probably not much we can do at this time. If it gets bigger or it doesn't go away, then we can actually take this bump off. But right now, I would just keep an eye on it.
I don't think it's gotten bigger.
Good, okay.
But when we first noticed it, it was scabby.
Okay.
And when I wiped it, it bled.
Okay.
Like with a pet wipe.
Yeah. Yeah.
So
yeah.
I wiped and it was bleeding. Then I think my wife, she has like some type of like ointment that's for like dogs or cats. So we put it on it.
Yeah.
And ever since then, it's been just like that.
Okay.
But like when you touch it, it's a bump.
It
right?
is a bump. I can feel it. And again, if it was, I'd give it more time just to see if it is just scar tissue, if that will flatten out.
Okay.
So I think we do 3 more weeks. We'll have the rabies vaccine, right? So we'll see what it looks like in 3 more weeks.
Yeah.
And there's
No, he's right. He's right.
Made his
That's my
rounds.
only concern with her. And I know it's a snag because
Yeah, it looks
Steph,
like it, yeah.
you saw my pup. Did you see the pup?
Yeah,
My
yeah.
pup? He eats them. Like literally eats them. So
What
and
a
they
stinker!
so he could have snagged them because he shakes them up. You know what I mean? Like
Oh, your heart's going so fast. Your heart's going so fast. Okay. One little poke. One little poke.
Do you want some more? You want some more
Don't be
treats?
sorry. I'm sorry. You know what's coming now, huh?
No.
Hold on.
Yeah, you did so good
I know
for that. Feels like my turn.
Hi, you're not shy at all, are you? Look, she's got more treats. I just licked your mouth. Oh, that was so good. Good job. I know, what's this lady doing? Look at her.
She really wants to go out and explore. Oh, you really like
They
the
look
treat,
wonderful.
huh?
You want to come up here now?
he's the aggressor for the food. Like
Yeah?
she's like she walks up to whatever, but he runs to the food. Yeah, he'll bump her out the way.
Yeah, you did
Is-
it.
is- if remember I told you that when I got them, they were both fit in my palm and in my hands. They're supposed to be brother and sister, but he is bigger than her,
Yeah.
right?
He is bigger than her.
But
yeah.
he wasn't when they were, in my palm of my hand. But now is that normal for the boy
Yeah.
to be a little bigger than
usually,
depending?
Yeah, usually. But they both look healthy. They
Yeah.
both look good. She's more lean. He's just a bigger, stockier build.
She in the weight because I got the litter. They use it. I know kittens are probably not supposed to, but they train themselves already. So I got the litter robot.
Yeah.
So they use it and it weighs them.
Oh,
So
that's cool.
she's like half a pound less. If she's 4.7, he's 5.3.
Yeah.
So it's like
but they both look healthier. I mean, they both
Yeah.
look healthy. She's just more on the leaner side, but she's healthy. So they're beautiful.
thank you.
And they're friendly. I know.
I mean, we got so many animals. They have no choice but to be friendly. There's so
love
many
it.
of us.
love
But
it.
like I said, Steph, yeah, so it was either him, it could have been one of the other dogs chasing, or my cat don't mess with them really. Well, now he does, but when that happened,
Yeah.
that's probably already like 2 weeks old.
Okay. Yeah, I mean, it does
It-
look like a lot of, I mean, it looks like scar tissue, but we'll see in 3 weeks if it's still becoming a problem, we'll figure out a plan for it,
Yep.
but it doesn't look infected.
No, I once I
Yeah.
saw it, I told you I took
And
it
you
to
put that ointment, yeah, perfect.
yeah, I don't remember what the name of my wife was.
Yeah.
Maybe
Was it
when I-
Airmax or something like that?
yeah, and actually I think it's meant for dogs.
There's some that dogs and cats, like some
Yeah.
have both.
Yeah, but I think it was meant for the dogs, but because cats
Yeah.
don't get hurt, but since so much action is going on now.
You're
But that's
so
the
cute.
otherwise, but like it doesn't, everything's
Yeah.
fine.
All
The
right.
feces and all of that,
Yeah.
everything is fine.
Well, I think they're bringing your boy in.
Okay, yeah,
So are they? You're okay with them out while they bring you
Yeah.
in? They get a.
yeah.
Yeah.
He's gonna, yeah.
Alright.
I mean, he's probably gonna be dopey. Is he dopey or is he like
I feel like he woke up pretty quick.
Oh,
When he
yeah.
goes home, he might sleep.
Yeah.
But when I saw him earlier, he was pretty alert.
Okay, bet.
Okay, you can't seek out though.
Yeah.
I'll put you in there while I escape.
Cool beans. Thank you, Doc. Come on. Come on. Come here. Come here. Where you going? Huh? Where you going? I'll make sure y'all good. Steel was eating. You wasn't eating, girlfriend. Sage, come on. Come on. Come on. Come on. We ready to go. We got Steph is coming right now. Your brother. Yeah, Steph, he's coming right now. Come on there. Come on there. You still cleaning yourself, bro? Stop playing. Aura farming ass. What are you doing? Huh? Come here. No. What are you doing? Trying to touch the garbage? Stop playing. Yeah, so knock this shit out. And we good. Next month, I gotta bring 3 cats and 1 dog. Kittens get their last shot. They good till next year. The big cat and the big dog, not the big dog, the old dog. They both get their yearly vaccinations and they're good till the next year. So everybody's good till next year. Come here. Come here. Who is that? That's the Steffi boy? That's my boy Steph. Huh. Papa.
So he's pretty awake right now.
Oh.
probably, I think, when he gets in the comfort of his own home, he'll probably just want to sleep it off. So, e-collar on at all times as possible, at least for the next 10 to 14 days, that we could get you guys back to just view the incision to make sure everything is healing nicely.
Okay.
Other than that, the only medication that we'll be saying going home with today is carprofen. You guys don't have to worry about giving this medication until tomorrow around 9 a.m. I have it written on the bottle and then also just on the discharge papers as well.
Okay.
Just because he got an injection that's 24-hour lasting long and it's within the same family as well. And it's just half a tablet of this every 12 hours.
Oh, half a tablet. Nice.
So,
And you could crush it?
yeah.
You could crush that half a tablet and put it in his food?
Yeah, you could sprinkle it on. You just want to make sure he eats all the food, just to make sure he gets all the medication.
I'll throw it in a treat, right? Put it in a treat? Okay.
That works too. And then other than that, just if you notice any changes within the stool, like darken, loosen, stop the medication, then let us know.
Okay.
It could just mean that he's having an allergic reaction to that medication.
Okay, and how long for the medicine?
Until gone, it should be at least for the next 5 days that we usually fill that for.
So there's like 10 pills in it? No,
There should
there's
be
one. That's
like-
once a day? That pill is once a day, half a pill?
Half a tablet every 12 hours, so twice a day.
So twice a day, one pill?
Yeah, so it looks like they did 10 days worth in here, so they should have 10 pills in here.
So
Your
so
technician
so
has
do the
to
10 days?
Mhm.
All
Yeah,
right,
yeah,
all
just
right.
finish this until gone. It's just a pain/anti-inflammatory medication.
Pain, anti-inflammatory. Okay.
Okay. And then
All
this
right,
side,
all right.
This has a clipping on one of his legs. That's just where they placed the IV catheter, which just means that's where they gave the injections and then the fluids as well.
Okay.
If you're any bruising, that should go away within a couple of days, and then the hair should go back within a couple of weeks. To
Yeah. That's fine. You put it on the back leg?
It's one of the front legs.
Oh, it's one of the front legs?
The
Okay,
right
cool
front
beans.
leg, yeah. We already took off the bandage, so you don't have to worry about that as well.
Okay.
And then any other special instructions, we have it already written down over here as well. Got the Serenia injection, which is an anti-vomiting, anti-nausea as well. When returning home, I would do like small amounts of water and then slowly, gradually increase to his food, just to slowly introduce, since he went into under anesthesia today, just a little by little. But
He's
other
crying
than
next
that,
to me.
and we always will check back with you tomorrow morning just to see how he's doing as well.
Okay, so I'll probably be at work, so regardless.
Okay,
But
no worries.
like in a couple of weeks, bring him in so you guys can look
Yeah.
at him again.
Yeah, at
Is
least
it-
in 10 to 14 days.
Or because I gotta come back, like for them.
Yeah, you could bring him back at the same time frame.
Oh my God! So I'm bringing everybody.
Yeah.
Everybody except Scotty.
They were
So because I got 6. I got 3 cats, 3 dogs.
Oh, really?
So one of the dogs is, or I did him when they did their first. So when I come, the next time I come, when they get their last shots, they're getting neutered and spaded too.
Oh, really?
Yeah. They definitely gotta get neutered and spaded, 100%.
That's good, yeah. Especially at the same age.
Yeah. Absolutely. They already too close.
Yeah,
All they do is
really?
sleep. All they do is sleep like on top of each
Oh,
other.
really? Yeah. Yeah,
I
well,
know,
I think
Papa. I know. The doctors was in there.
Yeah.
There was a whole bunch of them.
Yeah.
There was a whole bunch of. You good, man? You good, man?
He's like, go home, Dad.
I know they took your balls. You good, man?
They did, buddy.
Oh,
What
man.
happened? They took them, huh?
They got them somewhere in here. But okay, so cool. So I got that. All right. I guess I'll just talk to the front desk
Yeah,
about.
they'll take care of for the rest of the charges, and then
Yeah.
for scheduling wise, you can take care of that.
Which I already did, but now you're telling me that to bring him for a checkup though.
Yeah, just to make sure the incision is looking good. Because sometimes when they come back, we have had a couple of times that they'll come back for like a recheck, and sometimes the area is inflamed. Sometimes it's because they got the e-collar off and they just went at it at the incision and started licking at it.
Now he's gonna have to learn how to sleep now. As far as walking him, because now we could technically walk outside with him.
Yeah.
Should we wait still? Because he's close to the floor.
Yeah, at least walking as much as possible if you guys can.
Say that again.
When you guys take him out, at least on a leash.
Oh,
you
yeah.
can- yeah.
100% on the leash, of
that
course.
That should be fine.
So
If you guys-
even with his incision.
Yeah,
Okay,
yeah.
okay.
We don't want too much activity, of
No,
course.
no.
If you guys notice him still to be like, because a lot of the times they don't know their own pain. They sometimes they think they're like Superman.
Yeah.
We do want them to rest within the 10 to 14 days. If you guys notice that he's like too hyperactive, you can let us know and we can send home, which is like trazodone, which
Yeah,
is like
yeah. I think we might have some of those.
Okay.
Maybe not for him. We got it for Skylar and Scotty when they come
yeah.
here.
You can let us know, and then we could let our doctors know, and we could give you the dose that's within his weight
For him.
range.
Yeah. Awesome. All right.
And then I can have just a little signature at the bottom right here. And then if you guys have any other
Signature or
just the little initials right here.
can you?
And if you guys have any more questions or concerns, always feel free to give us a call or text us as well.
I'm gonna throw these dudes in the bag.
Yeah, it should be fine. And then a copy of these instructions is in this bag as well with your medications, and then your microchip number as well.
Oh,
Looks like
wow.
they did a microchip on him.
Yes.
So that it looks like they already registered him to your information, and so they just have the number on here as well.
Okay.
Do you have
I don't know the numbers to my other dogs. I don't know their numbers. Like I just know if you scan them,
They have it.
There's one of them. Like, is there a way to update that stuff? What happens if you move?
Yeah. If you bring them in and we could scan them and we could search up the number for you, and then we could give you the information of where to contact to make sure that is updated to your guys' address.
Yeah, because my oldest one, oldest dog, Skylar, the black lab, her scan is to like the Bronx in New York on the East Coast. I said that like you know what I was talking about. If you,
I've heard of it.
But the Bronx on the East Coast in New York City, that's where she's registered from. Because we lived in New Jersey at the time. It's her sister's address.
Yeah.
Anyway, so how do we like update that to like?
Yeah, like how I said,
So
whenever
when I bring her in 3 weeks, we can scan her.
Yeah, just make sure you let the technician know that you want her to scan her, and then she'll look up the microchip number, and then she'll print out a form that says where the microchip is registered to, and then that number you'll call and let them know, hey, I'm the owner, I need to update my information.
That's what's up. Sounds like a plan.
Yeah.
Now.
Do you need help out to the car?
Yeah. You want me to carry him or?
Carry him.
Okay.
I know.
What I did, you know what I did? I forgot to put his car bag in my car.
Okay, no worries.
That's what I forgot to do. So let me put these bad boys. Thank you though for all of
Yeah,
that.
of course. My pleasure.
That's me right there. So give me 1 second. I'm gonna throw these cats up
Yeah,
in there.
no worries. Take your time.
Ay. Yeah, everybody's done, Zoe. Everybody's done, Zoe. I'm gonna turn it on.